Video will be a demonstration of how to set up and save both an external and internal referral to Gynecologic Oncology view in Referral Management. I will also review the correct orders to be placed following triage for both external and internal referrals. It is important to save a view or a list for each your external and internal referrals because it will help to ensure that you place the correct orders once you have triaged the patient. Selecting the proper orders after triage is important for several reasons. The orders automatically update the status of the referral. They are a form of communication to the clerks and other providers. They ensure that the correct appointment type is booked for the correct amount of time with the correct healthcare team members. And all of this is important data for the BC Cancer Organization because it is used to inform on the number of new patients and wait times, for example. I'll go into more detail about these orders later in this demonstration. I'm going to begin by setting up the filters for my external referral triage view. Navigate to Referral Management and start with the location filter. Provincial Health Services Authority, BC Cancer Sites, BC Cancer Centers. We're going to look for the Vancouver Center. BC Cancer Vancouver Center. And we are going to look for the triage unit. BC Cancer Vancouver Ambulatory Care Unit Triage is the correct location for our external referrals list. For referral status, we are going to look for Ready for Triage. And for medical service, we're going to find Gynecologic Oncology. Perfect. Now, I don't want to have to set these filters every time I'm assigned for triage, so I want to save it. Click on the floppy disk and give it a helpful name. BCC External Referral to Gynoc. Say OK. I'm going to click refresh because this sort of speeds up the process of saving the list. There we go. There's our external referral saved list. Now let's run it and see who we have for referrals. Perfect. I want to point out that it looks like 2 of my patients are already being triaged by another provider. I can see here triaging provider. So let's pick another patient to begin. Let's choose Dana Scully, and I'm going to open her chart by clicking on her name. When the Assign Relationship window comes open, I need to select Triage Provider, so this too will be indicated on this referral list for other providers that might be looking at it. When the chart opens, it's going to open on the Oncology Triage Workflow page. This is where I can review the referral package documents or any information that's in any of these components. You can access the Oncology Triage Communication Power Form by clicking on this down arrow in the Triage component, down arrow. This is a tool that you can use to communicate with the clerical team members that manage referrals. Something to keep in mind is that if this is a redirected referral, it's the HIM referral clerks that you will be communicating with via this Power Form. Otherwise, it's with your Gynonc secretaries. When you open the Power Form, you would document whatever you want into this field. You'll click Save. And then when it gets opened up again, that information will be in this previous triage communication window. I can see there is a saved Oncology Triage Communication Power Form here. Okay. Once I've completed my review and I'm ready to place orders, I'm going to navigate to the Gynonc Outpatient Quick Orders page. This is where I need to take care to select the correct order to ensure that the status of the referral updates correctly, to ensure that the clerk knows what the next steps are, and to support accurate data collection for BC Cancer. This is the triage folder that where we're going to find all of our orders that we need to advance this patient's referral. And all of these folders, these subfolders, except for this bottom one, are used for managing external new patient referrals. To request a new patient appointment, we're going to expand the BCC-VA Oncology New Patient subfolder. And we're going to choose the Gynecologic Oncology order. This order communicates that the patient is accepted, which automatically changes the referral encounter to accepted and sends a new patient appointment request. New patient appointments also include an appointment with a nurse to complete the oncology comprehensive intake, which in some cases will identify patients that require a referral to allied health, like nutrition and patient and family counseling. And this order and appointment type also ensures that a best possible med history is documented. If it's unclear who should see the patient first, you will still use this order to request a multidisciplinary new patient appointment. But before we take a closer look at the order, I want to share a quick way of looking for the patient's address. Click on the patient's name in the banner bar. It opens up this custom information window, and we can see that this patient lives in Vancouver. I'm going to say OK here, and now I want to take a closer look at the order. Choose to modify so I can see it. Double click on it to open it up. And here is where we can see that I have to choose the location of either Surrey or Vancouver if I want a multidisciplinary team new patient appointment. For today, I'm going to cancel, and we're going to look at the other orders that are available for referrals. When it's clear that the patient does not need to be seen by Gynecologic Oncology first, perhaps they're not a surgical candidate, and you wish to refer them to medical oncology or radiation oncology, you're going to select the Oncology New Patient Redirect Referral to send this to the other medical specialty. This is going to update the referral status to redirected. When you click on this order, it's going to open up this order sentences window. It is best practice to choose this sentence of please refer to the Oncology Triage Communication Power Form. Of course, this means you need to be documenting in the Power Form some of the information about why you're redirecting this referral. Select OK. If the referral package is incomplete and additional information needs to be obtained from the referring provider, or if you are going to request additional labs or diagnostics before completing triage, you should select the Oncology New Patient Hold Referral order. This changes the status of the referral to pending. While this is in a pending status, clerks will monitor for the requested information or results, and once they have been received, the patient status will be set to ready for triage once again, which means that they will reappear on your BC Cancer external referral to Gyn-Onc view in Referral Management. Finally, select the Oncology New Patient Refuse Referral order when the referral is not appropriate for BC Cancer. When this is the case, it is also best practice to send a letter to the provider. You can easily find the provider letter note type and template on your Oncology Triage workflow page under Create Note. Here is Letter Provider. Okay, so now let's look at the second view that you need to set up in Referral Management to triage internal referrals. Let's go back to Referral Management, and we're going to be setting our filters, starting with a location one. We're going to start with the Provincial Health Services Authority, expand out BC Cancer sites, expand out BC Cancer centers. Under BC Cancer Centers, we are going to choose Vancouver again. We're going to expand that out. And this time, We're going to unselect the care unit triage, and we're going to look for the Gynecology Oncology unit. Here we go, BCCVA Gynecology Oncology Clinic. That is the correct location to receive our internal referrals. We're going to keep the referral status as ready for triage and the medical service as Gynecologic Oncology. Again, I want to save this filter so I don't have to do that every time. This time, let's call it BCC Internal Referral to Gynonc. And we'll say OK. Again, I'm going to refresh just so that I can have a look that my two views have been saved. Here we go. There's our external list and there's our internal list. Let's run the internal list and see if we have patients that require triage. Once again, we have a few patients here that are ready for triage. I'm going to click on the patient's name to open the chart. Let's choose Hera Olympus because it looks like they do not have a triaging provider yet. I'm going to select triage provider and say OK. Again, the patient's chart opens to the oncology triage workflow. And as a quick reminder, if you need to access the oncology triage communication power form, that's going to be here. In this case, you'll be communicating with your Gynonc secretaries through this power form. And once you're ready to place your orders, you're going to navigate to the Gynonc Outpatient Quick Orders page again. We're going to find all of the orders that we need in this triage folder, and specifically this last subfolder called the Oncology Internal Referrals. This has all of the orders we need for our internal referrals. It is important to use these orders in this folder for internal referrals because that makes sure that the order lands on the correct queue and work list for the Gynonc secretary, and so that these referrals can be appropriately processed and prioritized. We're going to select the Accept Referral BCCVA Gyn Oncology order if we're accepting the patient, and this will send a request to the Gyn secretary to book a Gyn Onc consult appointment. Or we would select the Reject Referral order for an inappropriate referral, or we would select the Referral Information Request order if we need more information. Missing from this folder at this time, but soon to be added, is the Redirect Referral order, if we need to redirect the referral to another medical service. That concludes this demonstration. Please email bcc_Vancouver_CST for additional support in setting up your referral management views and placing orders after triage. Thank you.